Today we're going to talk a little bit about diabetic peripheral neuropathy and peripheral neuropathy in general. And a lot of the questions I get from my patients with peripheral neuropathy is, why does diabetes cause peripheral neuropathy? Well, let's dive down in first. What is peripheral neuropathy? Well, peripheral neuropathy is usually a hypersensitivity or tingling, pain, burning, numbness in these areas. We call it stocking and glove sensation and distribution. Well, this will hurt a lot, usually at nighttime when patients are laying down or when they're more sedentary. Actually, when you're more active, you don't feel it as much because you can actually desensitize the area because you're moving around, you're using some other nerves in the area, and your brain doesn't notice it as much. So when you're sedentary, when you're sleeping, you notice this area a little bit more. And this is peripheral neuropathy. It's the longer nerves of your body are getting injured or destroyed, causing that numbness, burning, and tingling. Well, why does that happen with diabetes? That's a great question. Well, it's actually the sugar, the increased sugar or glucose in a diabetic that will actually attack the myelin. This right here, the myelin on the nerves is what insulate the nerves. It's like the insulation around the wire that lets the signal flow from, let's say, the feet to the brain, and it flows faster and better when there is good, healthy myelin around that. As that myelin begins to degrade or get attacked by the sugar, it's called the glycosylation of the myelin. If the myelin gets attacked by the sugar, it starts to break down, and that signal doesn't shoot or send as well from the long nerves in the hands and feet to the brain. When that signal doesn't send as well, the brain kind of gets a mixed signal, and it doesn't really know what to make of it, and it starts sending back signals that don't connect as well. That causes that burning, that numbness, and that painful sensation. There are ways to treat diabetic neuropathy out there. Sometimes we try with desensitization techniques, just like you're doing all day. You're walking around, you actually don't feel it as much, that burning and pain. You can also do some creams like a capsaicin cream. There's some medications out there like gabapentin. And there's also spinal cord stimulation for painful diabetic neuropathy that has been shown to help. Basically what that does is puts a stimulator in your mid-back, and that blocks that painful diabetic burning sensation from getting to the brain. So we basically block that signal of pain. But in general, that is why diabetes causes pain. So it also doesn't just cause painful diabetic neuropathy. It can actually cause issues with other organs as well because of dysfunction of nerves, because it attacks the myelin all over the body. So that's one thing to know, and that's one really big reason that we talk to all our diabetics to keep your A1C down. Because the less sugar in your bloodstream, the less sugar attacking your myelin, the less you will destroy that myelin and destroy that signal causing those painful symptoms.